Hello friends, welcome back to my channel. I am back with another remedy called alumina. So let's see about alumina. Common name of alumina is oxide of aluminium or pure clay or argilla. It is proved by Dr. Hahnemann. Thermally, alumina is chili. Miasm, sora. Temperament, hypochondriac. Diathesis, scrofulous. Let's see the introduction about the alumina. Alumina is prepared from oxide of aluminium. It is a kind of clay which is white in color, soft to touch. It is inodorous, tasteless, and also insoluble in water. It is a great antisoric remedy. Let's see how alumina is prepared. Alumina is prepared by trituration under class 7. How is the constitution of alumina? It is spare, dry, thin, having dark complexion, persons of sedentary habits who suffer from chronic ailments. What are the spheres of action? Motor nervous system, mucous membranes, especially of intestine and vagina, and also on skin. Let's see the pathogenesis. When acting on motor nervous system, it produces a state of paralysis, a paralytic condition. On mucous membranes, it produces a condition extreme dryness, lack of secretion, with more or less irritation. On skin, the skin becomes dry. Let's see the causations or ailments from lead poisoning, mild summer weather, warm drinks, in wet weather, disappointment. Mental generals. The patient is hasty, hurried, time passes too slowly, and hour seems half a day. Variable mood, one time confident, another time timid. Seeing blood or knife, she gets hurried, ideas of killing herself, though she abhors the idea. Apprehensive of losing her reason. She is confused about the consciousness of her personal identity. Sensation as if he would fall forwards, which he greatly fears. Mental symptoms are aggravated in morning on waking and ameliorated as day advances. Now let's move towards physical generals. Old people with lack of vital heat or premature old age with debility. Causes dryness of skin and mucous membranes of eyes, throat, rectum, etc. or irritating and relaxation. Girls dried up and wrinkled at puberty. It affects the cerebrospinal axis, causing disturbance in coordination and paratic effect. It causes paresthesia. In mental sphere, the consciousness of reality and judgment is disturbed. While walking, she is unable to close her eyes. Motor nervous response functions become sluggish. Reactions to stimuli are delayed. Example, prick of needle will be felt with delay. Impressions reach consciousness slowly. Mucus discharges are thin, acrid, and scanty, or sometimes these discharges may be profuse. Now let's see few more physical generals. How is the reaction to heat and cold? The patient is chilly patient. Appetite is abnormal. The patient has desire for charcoal, fruit, indigestible things, dry rice, acids, sour, starch, tea grounds, vegetables, cloves, and coffee. The patient has aversion for beer, with hunger, aversion to food, meat, potatoes. The patient has intolerance for potato. The patient totally disagrees potato. How is the sleep of alumina? Drowsiness in daytime, snoring during the afternoon nap. He cannot fall asleep before midnight. Dreams during menses, confused, drowning on foundering boat, falling off from high places, ghosts, robbers. Side affection, mainly alumina affects on right side, but also it affects the left side of teeth, abdomen, abdominal rings, back, and upper extremity. Let's see the general modalities. It is aggravated periodically in afternoon from potatoes, in morning on waking up, in warm room, tobacco smoke, caution, full moon and new moon. It is ameliorated in open air from cold washing, in evening on alternate days. Physical particulars. We will start with the head complaints. Vertigo, which is aggravated by talking on closing eyes or opening eyes before breakfast. Vertigo with white stars before the eyes when eyes suddenly went out of focus. one has to wait for normal vision. Headache as if one was dragged by the hair, which is ameliorated by lying quiet in bed. Throbbing headache with constipation, falling of hair, scalp itches and is numb. Eye complaints, eyes feels cold, eyelids weak, falling, thickened, dry, burning and smarting. Double squint, which is aggravated agglutination at night, lacrimation during day. Ears, humming, roaring, eustachian tube feels plugged. Nose complaints, tip of nose is cracked, nostrils are red, which is aggravated by touch. Scabs with thick yellow mucus, Ozena atropica sicca, which is atrophic rhinitis. Face, old look dusky wrinkled as of white of egg of a cobweb on face. Blood boils and pimples, involuntary spasmodic twitchings of the lower jaw, maxillary joint filled tight while chewing or opening mouth. Now let's see the complaints related to gastrointestinal system. Chronic irritations for years, which is aggravated in evening, can swallow but small morsels at a time, dry, sore throat, food cannot pass, sensation as a splinter or plug in the throat, left-sided abdominal complaints, colic like Penter's colic, inactivity of rectum, even soft stool requires great straining, diarrhea when she urinates has to strain at stool in order to urinate. Constipation, no desire for and no ability to pass stool until there is a large accumulation, great straining must grasp the seat of closet tightly. Stools are hard, knotty, like laurel's berries, covered with mucus or soft, clayey adhering to parts. Constipation of nursing children from artificial food, bottle feed babies, of old people, of pregnancy from inactive rectum. Urinary complaints, muscles of bladder paretic must strain at stool to urinate, frequent desire to urinate in old people, slow flow, retention with dribbling, smarting while urinating. Male complaints, sexual desire increased, voluptuous itching or tickling in genitals, involuntary emissions while straining for stools, followed by old symptoms. Extremities, pain in arms and fingers as if hot iron had penetrated. Arms feels paralyzed, legs fall asleep, especially when sitting with crossed legs. Staggers on walking, a clinical condition called locomotor ataxia. Heels feel numb, brittle nails gnawing beneath the fingernails. Skin complaints, dry, tottery, itching, eruption, which is aggravated in winter, intolerable itching of whole body when getting warm in bed, scratches until bleeds, then becomes painful. Let's do comparison of alumina with other homeopathic remedies in different aspects. Let's start with the moon phase. New moon aggravation is seen in alumina, ammonium carb, calcarea carb, causticum, cuprum met, sepia, silicia. Full moon aggravation is seen in alumina, calcarea carb, graphite, natrum carb, natrum mure, sepia, silicia and sulfur. Aggravation during increase of moon is seen in Arnica montana. Aggravation during waning is seen in Dulcamara and Thuja occidentalis. In paralysis, it is compared with curare. In curare, paralysis of extensor is more than flexor group of muscles, while in alumina, paralysis of both groups of muscles is seen. In anemic conditions, it is compared with natrum mure, while in natrum mure, he is chlorotic, cannot eat bread and has an aversion to it. While in alumina, patient cannot eat potatoes, they totally disagree potatoes. In nasal catarrh, it is compared with pulsatilla. In pulsatilla, she has tearful temperament but constitution is phlegmatic, while in alumina, she has tearful temperament but constitution is thin and dry. Hoarseness of singers. This symptom can be compared with rustox, phosphorus, alumina, argentum metallicum, hypersulf, dulwich, nitric acid. In rustox, in beginning weak and husky, but after using little it is clear. Hoarseness in warm room. In phosphorus, voice becomes painful with pain in vocal cords. Alumina and argentum metallicum, paralytic hoarseness is seen. In hypersulf, dulwich, nitric acid, sensation of splinter in the throat. Clinical indications of alumina. These are the conditions in which alumina can be prescribed. In anus affection, skin affection, constipation, constipation of infants, cough, diarrhea, dysentery, headache, leukorrhea, locomotor ataxia, menstrual disorder, nervous affection, Uzena atrophica sicca, which is atrophic rhinitis. Remedy relationship of alumina. Alumina is chronic of bryonia. It is complementary to bryonia ferrum, follows well argentum metallicum bryonia. Antidotes: bryonia, camphor, chamomilla, ipecac. Plumbum met in case of lead poisoning, in case of Penter's colic. Duration of action of alumina is 40 to 60 days. Alumina is a deep acting remedy which acts slowly for long time. Dose 6 to 38 and higher. Action is slow to develop. References: a study of Materia Medica by Dr. N.M. Chaudhary, Borik's New Manual of Homeopathic Materia Medica with Repertory, All-in-One Homeopathic Materia Medica by Dr. Niranjan Mohanty, Allen's Keynotes by Dr. H.C. Allen, a Dictionary of Practical Materia Medica by Dr. J.H. Clark, Materia Medica of Homeopathic Medicines by Dr. S.R. Pathak. Thank you.